Chair recognizes the gentlelady from Iowa, Ms. Miller-Meeks, for 2 minutes.
Thank you, Mr. Chair. And Secretary Mayorkas, if wall didn't work, Speaker Pelosi probably disagrees with you because we had a wall up around the Capitol for, I don't know, over 6 months or so. But just this month, the Department of Health and Human Services extended the COVID-19 public health emergency for another 90 days. As you know, only 12 days earlier, the CDC, which is a component of HHS, decided to terminate its order under Title 42. I'm on multiple pieces of legislation that would require the implementation of Title 42 until the COVID-19 public health emergency is lifted. As a physician, as a former public health official, I'm interested to know, Mr. Secretary, if Dr. Walensky or anyone from the CDC contacted you to consult with you prior to their April 1st announcement. This is a yes or no question, please.
Congresswoman, the law requires consultation, and we did consult, and what I did was provided data with respect to the number of encounters, the number of
That's good to hear that you're consulting the experts, and I'm sure you would be very willing to transmit to us all emails and phone conversations, transcripts of those conversations with the CDC. You stated in your testimony that you expect migration to increase. You've also stated that more than 18% of migrant families and 20% of unaccompanied minors who have recently crossed the U.S. border tested positive for COVID. So I find it interesting that despite these statements, you still believe that lifting Title 42 is a good idea. But moving on to another question regarding our immigration system, I visited the border 3 times being sworn in. I have heard of horror stories of children being smuggled. I have heard of the rape trees. I've heard of the cartels using children as pawns and people attempting to recycle children. In fact, one of these incidences in the RGV sector years ago, a woman and child were apprehended. The woman was then caught spitting into the child's mouth to get DNA samples. Mr. Chairman, I ask for unanimous consent to enter the OIG report and an article on RGB incident into the record. Mr. Secretary Mayorkas.
Without objection, so ordered.
Thank you, sir. Secretary Mayorkas, as you prepare to lift Title 42 restrictions, will you use DNA testing as the last administration did to ensure familial relationships between adults and children at the border?
Gentlelady's time has expired.
Mr. Chairman, may I have 15 seconds?
Because 15 seconds.
The bounds of my consultation was that I provided data to the CDC with respect to the number of encounters, the number of individuals that a Border Patrol facility can house, how many people we were housing at a particular time, and data with respect to what we were experiencing at the border. I am not a public health expert, nor did I provide public health advice.